Go.
Okay. Hi, Courtney. How are you doing today?
Good.
My name's Renee. I'm going to be your nurse today, and I see you had a beautiful baby boy.
I did.
How's things going?
Good.
Good. Did you decide if you were going to have him circumcised or not?
I'm still not sure.
Okay. Well, do you want to go over some information about it to kind
Yeah.
of help make your decision? Okay. Circumcisions are done for surgical reasons and surgically for medical and religious reasons. Back in the early days, they used to do circumcisions because they said they were more for hygiene, but now they're really just cosmetic.
Okay.
Some of the advantages of circumcisions are they reduce risk for developing urinary tract infection in men because they don't have all that skin there to keep the bacteria. And then it can reduce their risk of getting STDs later in life, and it can reduce their risk for penile cancer. Some of the disadvantages is it can reduce some sensitivity down there, and then potential complications could be excess bleeding or postoperative infection. Okay? Some of the reasons it would be necessary if you don't do it today is if they would get pyorrhinosis, excuse me.
What's that?
It's a medical emergency where the foreskin, like if you would be cleaning and then you would pull the foreskin back, it would get stuck and it would kind of be compressing like a tourniquet on the penis. So he would have to go in and have it surgically fixed and basically be circumcised at that point.
Okay.
And then also villanophositis is an infection of the foreskin. It's usually because of bacteria like a UTI infection. It's pain when he's going to the bathroom, and you might have pus coming from the penis, so that's a reason that you would want to go ahead and get that done.
Okay.
And I mean, it's really up to you. It's your choice what you would like to do. So,
I'll talk it over with my husband and I'll let you know.
okay, that sounds like a good plan because it's definitely something you want to be sure of to do. Okay? I'll be back in a few minutes to check on you. 10 minutes later. No, just kidding. A couple days later.
Still recording.
I know.
Okay.
Okay. Hi, Courtney. I'm back in to see how things are going. Have you talked to your husband?
Yeah, I think we're going to go ahead and do it.
Okay. I think that's a good plan. I'm going to take the baby, and then I'll bring him back, and I'll kind of go over how to care for the circumcision and things like that for you, okay? So I don't want you to be scared taking him home.
Okay.
Okay.
Is it going to hurt him?
He hopefully will not cry very much. We do give him a little sugar on their binky to kind of help decrease the pain stimulation, so then that will help. And we do a little local anesthetic.
Okay.
Okay?
Okay.
Okay. Thank you.
Yeah, I think so. Let me grab my baby here.
What are you doing?
3:30.
I don't know. We can go back to the common.
Okay, Courtney, here's your baby. He did really good.
Good.
I'm going to kind of go over things with you now on how to care for the circumcision.
Okay.
Sorry, I'm going to get my handouts for you as well, okay? Okay. He will not be given any medications for this procedure, okay? You can give him the acetaminophen, which is Tylenol, at home.
Okay.
The dose is on the bottle for the babies, so antibiotics would be needed if you would notice any kind of red streaking, any kind of pus drainage,
Okay.
any kind of fevers for the baby. Those are all signs of infections that you would need to give your pediatrician a call for to note, okay?
Do I need to put anything on him when I change his diaper?
I will get there. Hang on. Okay, here is your paperwork that I'm going to go over with you as well.
Okay.
We did do the Plastibell for the baby, okay? It's a ring inserted and surgical string is tied around the foreskin and tightened into a groove into the ring. The foreskin is trimmed away, okay? This is according to Heartland.
Okay.
Because the physicians usually have preferred methods of instruments used in the circumcision is left up to the physician, so that's why he just went ahead and did it that way. Aftercare, the type of care you need to provide varies on the types of circumcision. So, the plastic ring will fall off on its own in 3 to 10 days. You don't tug on it or anything like that. You just leave it on its own. It is normal to see yellowish colored tissue at the point of the separation. You may also notice that kind of tissue looking at the umbilical cord where we've cut his cord. So it's that same kind of skin. If you notice anything different, you can give us a call or if you're unsure. The tissue is firm but slick at the touch.
Okay.
Pus is thick liquid. Simply touching the tissue should help you tell which is which.
Okay.
The penis should be cleaned with a warm, wet washcloth when the infant soils the area. Wipes are not recommended until after the circumcision heals completely. So just use warm, and I wouldn't put any extra stuff on there. I wouldn't even do any soap or anything. Because that could irritate the area.
Okay.
Sometimes people ask, what do they do if the ring is partially attached? And you don't do anything. Like I said, you just leave it on there.
Okay.
And then if you have problems or questions, you can always bring them into the doctor.
Okay.
Okay. Sometimes the adhesions can form, which is where the foreskin will still attach itself to the penis. So if that happens, you just need to call, and it can happen, several weeks or months after the circumcision. Just give us a call, or you can try to push the skin behind the tip of the penis.
Okay.
And you may have to do it several times to get it to stay. Do not do this for the first 2 or 3 weeks, okay? So that's because it's going to be in the plastibell, so just leave it alone, okay?
Okay.
And I'm
So
gonna
it'll take weeks for this plastibell to fall off?
No, the plastibell will come off in 7 to 10 days.
Okay.
But it will take weeks for it to heal completely.
Okay.
Okay?
Okay.
So here is your paperwork for you to go home with.
Okay.
And all this information I gave you is from the CDC website and also from Heartland's website, okay?
Okay.
Do you have any other questions?
I don't think so.
Well,
Thank
have fun
you.
with your baby. You're welcome.
Right.